Hello, and you are tuned in to Hawthorn University's Holistic Health and Nutrition webinar series, and I sure want to thank you for joining us as we welcome Aimee Raupp for her presentation, Optimal Health Equals Optimal Fertility, even for a woman in her 40s, and how to manage modern fertility challenges with nutrition and lifestyle support. Let me give you a little bit of background on Aimee. She is a renowned women's health and wellness expert and the best-selling author of the books Chill Out and Get Healthy, Yes You Can Get Pregnant, and Body Belief. A licensed acupuncture and herbalist in private practice in New York, she holds a Master of Science degree in Traditional Oriental Medicine from the Pacific College of Oriental Medicine and a bachelor's degree in biology from Rutgers University. Aimee is also the founder of Aimee Raupp Beauty line of handcrafted organic skincare products. She has appeared on The View and has been featured in Glamour, Allure, Well and Good, Goop, Shape, and Redbook, and has received endorsements from Deepak Chopra, Dr. Christine Northrup, Ariana Huffington, and Gabby Bernstein for her work in helping thousands of women to improve their vitality, celebrate their beauty, and reconnect to the presence of their optimal health. Aimee is also the head of Chinese Medicine at the Well, an active columnist for media outlets such as Thrive Global, Well and Good, Body Mind Green, and is a frequent speaker at women's health and wellness conferences across the nation. She engages her large community worldwide through her online programs and with her website, aimeeraupp.com. So just a little bit about this. In the presentation, Dr. Raupp is going to address fertility and female physiology, the typical blocks to female fertility, and then introduce the 3 pillars of body belief to reconnect, renew, and reawaken. Environmental, emotional, and nutritional toxins, as well as lifestyle and diet will be addressed, including the different diets for fertility. And so importantly, the mental and emotional spiritual piece will be included too. We sure don't want you to miss a thing, so this presentation is being recorded and it'll be available for replay on our website in just a few days. You know, we've had such a great deal of excellent content tonight. That's what I expect. So we'll likely go 90 minutes for the presentation, followed by Q&A. So please write your questions or comments into the webinar question panel at any time so you're in queue. Also want to let you know there are 2 handouts that Aimee is providing, and you can find them on the webinar control panel. Look for the tab handouts, and you can download those. I'm your host, Paula Bartholomew. I'm one of the founders of Hawthorn. And now with all that said, it's time to welcome you, Aimee. Hello.
Hi, Paula. Hi, everyone. Thank you so much for having me. And apologies that you can't see me. My computer kept crashing when we tried to launch the webcam. So you're just going to get my slides this evening.
It's good. And I'm just so grateful that you're here with us and presenting, Aimee. You've got a great presentation going. So when you're ready, I'm going to turn it over to you.
Yeah, I think I'm ready.
Okay.
This is really exciting. I got really excited getting into this because what I do a lot of my day, either I'm in the clinic or I have my online programs and I'm teaching the woman who is trying to conceive how to manage her fertility and manage her autoimmune condition. And it's really exciting to me to be able to talk to other practitioners out there and I think spread the word on some really important topics that might be overlooked by clinicians, not intentionally, of course, but just for lack of, better education out there for all of us. I feel like I had to go and really dig to find the information that I now use in my clinic and in my online coaching business and in my courses, and I'm really psyched to be able to share that with all of you. And I have been in clinical practice for 16 years, so I feel like I've learned a thing or two from, that really hands-on perspective. So yeah, I might miss things. I might, we'll see how it goes, but write in your questions if you feel like I'm overlooking things. And I have resources for you at the end. And then there's also 2 handouts that I think will be really helpful for you guys. And we'll get to them as I'm talking. So I entitled this talk, well, Optimal Health Equals Optimal Fertility, which is just kind of my go-to. This is what I always talk about in the clinic, with my clients, with other practitioners, with associates of mine. that there is no special fertility diet, there is no special fertility acupuncture, there are no special fertility herbs or supplements. What we're really trying to focus on is managing optimal health. And when health is optimal, fertility will thrive, even for a woman in her 40s. And then I further entitled this, How to Manage Modern Fertility Challenges with Nutrition and Lifestyle Support, because most of you guys are studying these types of things at this moment in time, and that's where your interest is. So part one, how the fertile female body works. Some of this I think may be known to a lot of you, but I'll still go through it because I think it's good as a refresher. But I want to first start with this important piece of information. Fertility flourishes when the body has more than enough to give. And this next statement may sound a little cruel, especially to any women out there who are trying to conceive, and it's not meant that way. It's just how I think clinicians need to look at it. Fertility is a luxury, it's not an automatic. Now, it is an automatic, if you will, in the female body. The female body is made to be able to procreate. However, if the female body is under a tremendous amount of stress, or she is not eating enough, or she is not sleeping enough, or exposed to environmental toxins, or is dealing with a major illness that's maybe undetected or is detected or has an infection, any of these things, the body will say, I do not have the goods to go on and make a child. Sorry, that's not my priority right now. And so that I really think that that's an important lens for us to look at it through. And, I'm a practitioner of Chinese medicine, right? So, I think about things from a qi and a blood and an essence perspective, which I'm going to go over a little bit because I think it's, always important for us to understand all the modalities out there. But we say, literally, like when a woman's period comes, it is an overflow. It's an abundance of blood that she has to give up. So that's really important to think about. Like, she has an abundance to give up so she can then shed her lining and have a menses, right? She can then create a healthy follicle, and it will then ripen and rupture and potentially get fertilized and potentially implant and potentially make a child, right? She has this enough to give. And so the first place we have to start as clinicians, and when we're thinking about fertility, is how much extra resources does this person have? I was hearing, I listened to Chris Masterjohn a lot, and if you guys don't know who he is, you should check him out. But he's a PhD in nutrition, and he's brilliant. He's got a great YouTube channel with some really interesting, I think he calls it bites or something like that. They're like little tidbits on, all sorts of interesting nutritional things. But I was listening to a conversation he was having with one of the women from the Dutch test, and he was talking about, like, the body literally looks at fertility and says, do I have an extra couple thousand calories to give up a day? I'm not sure I do, and to start to think of it that way, that yes, the female body is made to procreate, and so is the male body, right? And we want it to be as simple and as easy as possible. When we introduce all these other environmental influences, or we're waiting till later in life, which I don't think should be a major hindrance, but if we are waiting later in life, which I had my child at 41, and more recently had a miscarriage at 45, but got pregnant pretty easily. So I'm sure I'll do it again. But I say that because the later we're doing it, the more I think intensely we have to approach it, because now the environment has had further time to impact us. Stress has had more time to impact us. Our diet, our lack of nutrients has had time to impact us. So, to continue to think about this from this broader holistic perspective, that this is about having the resources to create a human life. And that's a really serious job, and it's phenomenally magical. And there's a lot of, magic that goes into it, I think, that is beyond any of our scopes. But to want to give your client the best goods possible, and to really think of it that way. So, long intro, but I think it's really important to keep top of mind. Okay, so what a normal menstrual period should look like. I go over all this in my book, and in fact, this slide these next 3 slides are just pulled right from my book, Yes, You Can Get Pregnant. And now a regular menstrual cycle comes every 28 to 35 days. I do think there should be an asterisk there. There are women that just ovulate later and still can get pregnant and have a 60-day cycle or a 40-day cycle. And another asterisk to say we are not robots, and it's not that big of a deal if your cycle changes month to month. Obviously, if it goes from 28 to 60, I'm a little concerned, but if it goes 28, 32, 33, 26, not that big of a deal, you know. But the flow, this is the bigger deal to me. The flow should be bright red. It should come and go in a tapered fashion. The first 1 to 2 days are the heaviest, about 6 to 8 teaspoons of blood per day, and that's about 6 to 8 regulars or 3 to 4 supers. I do recommend pads over tampons personally in my practice. The flow tapers off gently over the next 2 to 3 days, and you can read there 2 to 4 teaspoons, 2 to 4 regulars, and there should be minimal clotting with slight breast tenderness and very little cramping. That's what a regular menstrual cycle should look like. As a Chinese medicine practitioner, I really dissect this. You know, if there's clots or there's cramping, I think of like blood stagnation. If the blood is darker, I think blood stagnation or cold. If the blood is lighter, I think blood deficiency. So, you know, we get into it a little bit more than I think the average. But the flow, that there's enough blood. Like if I see a really light flow, the first thing I think of is the lining isn't thick enough to hold an embryo if it implants. I got to thicken her blood. Meaning I got to increase her blood, basically. Typically, too, you'll see it in her labs. Her hematocrit and her hemoglobin are low. Her, you know, her iron levels or ferritin might be low as well. You know, and you'll see like anemia type of symptoms. So that's where your focus should go, right? Your focus should go to optimal health. Okay, she's got these anemia-like symptoms. What do I do to support and treat that? Versus thinking just through the lens of fertility, right? And we created this for social media. People love it. Optimal, you know, this is a period color chart, sorry. So kind of like the 2 top prongs are the ones that I think are the best. That bright red to a little bit of wine-ish red. Well, I guess if you're looking at it, yeah, the left side, those are a little more on the blood deficiency, a little paler, a little brighter. Could be normal. Then I think, you know, I'm looking at the third one now. That's a real healthy looking flow. Then it's getting a little darker. And then as it gets darker and darker, we start to think old blood. I start to think the uterine lining isn't shedding properly. Each month there's some stagnation in there. Acupuncture is amazing for that. Mayan abdominal massage, castor oil packs. That's where I pull out these kind of guns to really get things flowing again. Chinese herbs. You also want to think about here too of like, is she detoxing properly, right? What's her, you know, we're not going to talk too much about methylation, but thinking about that type of stuff. I do have an MTHFR handout for you guys to how to better support methylation in the body, and the MTHFR and how important that is here especially in fertility. But that's what I would think about more from like a clinical perspective. So I kind of have 2 lenses. I think about Chinese medicine, and then I think about, you know, more functional medicine, right? But either way, you want to see this bright, beautiful red, healthy looking, like fresh blood. That's what you want to see. You don't want to see old dried blood. You don't want to see pale pink, and you want to see a good healthy flow. Okay, so ovulation, obviously super important. You can't get pregnant if you don't ovulate. An efficient ovulation that occurs between cycle days 14 and 21. So with cycle day 1 being the first day of menstrual flow. So a lot of the apps can get really confusing for women because the app assumes you have a 28-day cycle. It assumes you ovulate on day 14. And we're not robots, and that's not always the case, right? And the app does tend to learn women over time, but a lot of women will come into me and they're like, my app says I'm ovulating, you know, but they don't have any signs or symptoms of ovulation. The previous 2 menstrual cycles were, you know, 34 days. And so that, to me, what I always do is I subtract 14 from the length of the cycle. So if it's a 34-day cycle, meaning that's the last day of their period, then on cycle day 35, they bled. So that's cycle day 1. I subtract 14, so cycle day 20. That's when she probably ovulated, right? So I almost have to retrain my clients to start to think about the fact that they could be ovulating later than the app says. Some women will use those predictor kits and they'll get false positives, and they'll try then, and then they'll stop trying, and they're actually missing the window because they might get another surge. So there's lots of things to think about, like that these modern tools aren't always the best for us. What we really want to do is teach our clients what to look for. So ovulation, the day of ovulation varies depending on the average cycle length. Ovulation should come at midpoint of your menstrual cycle. So if you typically have a 30-day cycle, ovulation should occur around 15. It should come with a few days of clear egg white cervical mucus and an increased sex drive. So this is a question I always ask in the clinic. Always, always, always. Most women have no idea. I love them, but I have to teach them, and that's okay. Some women feel a slight twinge or heaviness in their ovaries. That's middle schmerz, it's called, and it's normal. We don't want to see sharp doubled over pain. That's not great sign. You know, it's usually more stagnation there or ovarian cyst type of things. But a little bit of like a fullness feeling, totally normal. Some women even have a little pain with sex around ovulation because they're so much fuller. Someone will feel slight breast tenderness, also considered normal. If you're tracking your basal body temperature, this is a time of the month where your temperature should rise at least 0.4 degrees. I didn't get into BVT in this presentation, but that is, I think, one of the better mechanisms. I also just would say I treat a lot of fertility. Basal body temperature charting can make women a little, dare I say, crazy. You know, it's a little too much attention to detail. And so they start to really overthink everything. And then, you know, is this going to be the month? You know, so it's a heavy conversation too. But so just so you know, like, I think it's more important that we see signs and symptoms of ovulation, and that a lot of women are missing their window when they're using those apps or those predictor kits. So really to teach them to either use the basal body temperature charting, even for only a couple cycles, so they learn what it all looks like for them, then you can drop it. But also the signs and symptoms. And then the luteal phase, which is a really important phase, right? Because this is showing us that we have enough progesterone to hold a pregnancy. If it were to happen, you want to see a 12 to 14-day luteal phase. So if you're doing BBT, after you see that spike, it should stay up that 0.4 degrees or higher for 12 to 14 days. It should be free of any major premenstrual symptoms like breast tenderness, heavy cramping, spotting, mood swings, fatigue. Normal symptoms occurring at the end of the phase, just a few days before, are mild lower back pain, lower abdominal cramping, slight breast tenderness, slight mood sensitivity, subtle food cravings. So let me just see. Okay. That's another thing, and I talk about it in a couple slides, I guess. But PMS, extreme PMS, women having to miss work because of their period, things like this are not normal. And again, you got to step back and say, okay, I got to fix this kink in the system before I can help them get pregnant. Not to say that women with really bad PMS don't get pregnant. Totally happens all the time. But if you have a more fertility specific case, and she's not getting pregnant and she has really bad PMS, you should think about how can I better support that, right? And we're going to get into diet and supplements and stuff, but you know, you want to think like, you know, she should be eating a ton of cruciferous vegetables, right? They should be more cooked than raw. I still am a fan of animal protein. We'll get into all that, but good quality, smaller amounts, you know, some movement. What are you doing to help her body kind of rid if it's excess estrogen, but it could also be progesterone deficiency. So we'll get into that in a second. So how the whole HPO axis works, right? The hypothalamus is in the brain. It releases the gonadotropin releasing hormone. This is all from my book as well, page 24 of Yes, You Can Get Pregnant. The gonadotropin releasing hormone talks to the pituitary gland, and then the pituitary gland releases the FSH and the LH, follicle stimulating hormone and luteinizing hormone. And the FSH will kind of tell the follicles to start growing. LH tells the body to ovulate, right? Ovulation is the rupturing of the follicular sac that contains the egg. Estrogen is involved in helping the follicles ripen, grow and ripen, and then progesterone helps maintain the lining and warms up the body to prepare for pregnancy, right? And pregnancy either happens and progesterone levels are maintained, or pregnancy does not happen and progesterone levels drop off, the uterus sheds its lining, and the whole thing starts over again, right? And also on the next page in Yes, You Can Get Pregnant, I go over BBT charting, the basal body temperature charting. So if you're interested in that, you can take a look, but you could also just quick Google it. So this is just kind of a quick summary of how it all works and all the hormones involved to have a normal, regular menstrual cycle. And sometimes our job is to figure out where this hiccup is happening, but not necessarily. I think if you focus on optimizing health, the hormones know what to do when they're given the right tools, and they'll come back into sync. So I'll see a lot of practitioners out there, saying like, oh, put her on maca, it'll help with estrogen, or put her on Vitex, it'll help with ovulation, put her on progesterone, it'll help with the luteal phase. And that's all fine, but that's a Band-Aid. You still want to get to you want to understand like the root of the problem. And I think the root of the problem is really the overall optimal state of health, right? So I kind of touched on this already, but PMS, what it tells us and why it's not always estrogen dominance. This might not, I feel like it's still there because of the people I follow on like Instagram, and they talk a lot about estrogen dominance, and you got to clear out the excess estrogen, and that's the root of all these PMS problems. That's the root of breast cancer. That's the root of cystic breasts. That's the root of endometriosis. And maybe is the answer, but it's really about the ratio of estrogen to progesterone and to testosterone, right? And so understanding that they all play a role, and it's really about bringing them all back into balance versus, I do a lot of work with the Dutch test, which is, if you don't know it, it's like a hormone test. You can use the urine, you test the hormone metabolites, and it's really a cool tool to use in your practice. It depends on your scope if you can use it or not, but anyway, they come with these free consults that you get with these functional medicine doctors who are all just brilliant, and I get to pick their brains on my cases, and I love it. But they are so cautious about clearing estrogen with something like DIM, indole or detoxing too much, because those things can be indiscriminate. They'll clear good estrogen and bad estrogen. So you don't want to clear out too much estrogen in a woman who's trying to get pregnant, because estrogen is really important, right? So you want to be able to look at the whole picture and assess like, what else is going on, and not just do this, targeted therapy, if you will, but more continuing to look at it very holistically. And so I was just going to say, my practitioners, or my peer group, we can do the same thing. We can get very compartmentalized and look at fertility from this perspective of, okay, we have to build kidney essence. That's what we talk about in fertility, right? And I study with a mentor of mine who looks at it very differently. It's really about improving the quality of the blood, because the blood bathes the follicles, so then they get to ripen, and the blood creates the uterine lining, and that it's not so much just about essence, and you'll see some practitioners, or at least I do in my group, that just use these standard formulas, and they're really not properly diagnosing the patient at all. And it's frustrating. So what I would say is, to try not to fall into these categories of like, oh, Vitex, yeah, Vitex is good for hormones, use Vitex. Oh, maca is good for hormones, use maca. Really rather kind of step back and look at the whole picture, because then you're basically just, treating what ails them with a supplement, you know, which is the same as Western medicine can do with medications, right? So to really, you know, use this holistic viewpoint, I can't say it enough, and it's one thing I've learned a lot in the years. I found in my practice early on, when I was focused on just treating fertility, I had a hard time helping women get pregnant. But then I noticed that I had this other set of my practice that were women who were coming to me for other issues like GI issues or anxiety or sleep or stress at work. And I would work on that. And then when they tried to get pregnant, you know, when the time was, you know, when it came up for them, it happened. And it really taught me something. I was like, oh, what am I doing differently? Oh, I'm focused on the whole picture with them, with the fertility girls. I'm just focused on the fertility. And I'm just giving them these like fertility herbs. And so then I step back and I, you know, and I have this in my e-course that, you know, is for women trying to conceive in, you know, the layman, if you will. And it's called, what are the kinks in your system? So I have them look at like, what are the kinks in your system? Let's fix that first. So it could be gas, it could be bloating, it could be, you know, anemia signs and symptoms. It could be really bad PMS. It could be back pain, right? It could be headaches. That's the stuff I want to work on, because then that tells me, okay, the kinks in the system have gotten fixed. Now fertility should thrive. It should flourish. And Chinese medicine, we really break it down into this qi, this essence, and this blood, which I put it in here because obviously it's the, you know, I have a strong biology and chemistry background, but then I'm also, you know, I practice Chinese medicine and I love it. So it's the root of a lot of what I do. So qi, when we talk about qi, is our life force. It's at the root of our health and vitality. Without qi, there is no life. We say, you know, you can't add qi with acupuncture needles. You can move qi around, but the number one way to add qi to the body is through diet and through lifestyle. Essence is kind of like our genetics in Chinese medicine. It's our foundation of health, longevity, fertility. Each organ, system, substance in our body has an emotional component too, which I do think we could use to look more at in this holistic model, which I'm going to get to. But our essence suffers when we have fear and doubt, right? So and our qi suffers when we have worry, and our blood is considered the most important liquid substance. It nourishes tissues and organs. Circulation is imperative. So same as Western medicine. And without blood, life does not exist. And blood in Chinese medicine is created from two sources: the food we eat and our essence. And so we say too, you're born with a certain amount of essence, and then you build up essence depending on the quality of life you live. And in one of our older texts, it says, if you live in accordance with the Tao, D-A-O, so that means in accordance with the seasons and nature, and following the flow of life and not burning the candle at both ends, you will continue to build your essence. And a woman who does that should be able to procreate until her late 40s. 49 is the number they say in the Neijing, which is one of our oldest texts in Chinese medicine. And I talk about that. I have a whole chapter on that in Yes, You Can Get Pregnant, about getting in touch, living in the flow of nature. And so it's about sleeping enough, eating, you know, in a balanced way, being at a healthy weight, moving, getting outside every day, which really helps with that whole hypothalamus, the HPO axis. Growing a garden, you know, being in touch with nature that way, turning off your electronics before bed, meditating. So all of these little tools, having hot sex, that's one of them I talk about. Keeping your child's palace warm, the uterus, the direct translation for the word uterus from Chinese to English is child's palace. Qigong is what it's called. And that's how special this place is to us. You know, we don't have ovaries, we don't have like a hypothalamus or anything like that in Chinese medicine, but we do have a child's palace, and that's our whole reproductive system. So qi and blood and essence are our vital substances, and without them being in abundance, it's challenging to procreate. And as a woman ages, these things will decrease. And I know I'm very female focused. I do get to a little bit of the male factor stuff in the next section. So I'm not being sexist on any level, but we do tend to deal with the women who are trying to get pregnant, and a lot of times there are male factors, and we kind of, there's tools for that too. But the child's palace is really important to us. It needs to be abundant and have this overflowing of this essence and this chi and blood, and that's when her fertility should be thriving. And so, if the cycle is off, meaning she's not bleeding enough, she's not ovulating at the right time, her luteal phase is too short, you want to think about, okay, her chi and blood and her essence, or, what you guys would see from a more clinical perspective is like, okay, her hormones are a little out of balance, and I have to best support her to get back into the rhythm, the nature of her body, right? When we support the body in doing what it needs to do and helping it achieve this abundance, fertility will just fall into place. I'm gonna have a sip of my tea. So the most common reasons for fertility challenges. Again, a lot of this is in my book. I'm gonna read from certain sections on it to go over it with you guys. So there are basically 4 main reasons that the Western medical world will see are contributing to women having fertility challenges. Something like 30 to 40% of all women dealing with fertility challenges, and notice I don't use the word infertility very much because I think it's just a really crappy word, because it basically means that the woman is broken, and I do not believe that. I do believe that there is a kink that needs to be fixed, and she could use some fertility rejuvenation. But I recommend to anybody I work with to not even use that word, because I say it hurts your heart. And it really puts you in this broken mentality, which my more recent book, Body Belief, is very much about that piece where if you don't believe in your body and its ability to do the things you want it to do, it's going to be hard to achieve the state of health you want to achieve. So just a side note, you'll notice I say fertility challenges a lot. I do not use the word infertility. And if you want more on that, my first chapter in my book, I talk about it. But so 30 to 40% of fertility challenges are unexplained infertility, they call it. So they don't know the reason. And what I think I discovered when I was doing research for Yes, You Can Get Pregnant, couple that with my clinical experience, was that most women with unexplained fertility challenges actually have an undiagnosed or a mismanaged autoimmune condition, which I'm going to get to. But so very few women dealing with fertility challenges have this first one, structural and anatomical blockages. You'll see with like severe cases of endometriosis, there might be blockages of the fallopian tubes, which some cases is IVF is the only option. Some cases you can unblock it. It takes time. So it just depends on how much time you have and how much patience your client has, but it's out of our scope, a lot of us. If I sense severe endometriosis, I'm typically referring them to a reproductive endocrinologist, immunologist, who will maybe do a laparoscopic surgery. It brings up an important point that I didn't put in this lecture. I am not at all opposed to working in tandem with fertility doctors. A lot of times I need to, especially in cases of severe endometriosis. I might need her to get a laparoscopic surgery. It kind of just depends on her time frame. If she's got a year to give me on the diet and the lifestyle, I could probably handle the endometriosis. But if she's been actively trying for 5 or 6 years and is severely sad and depressed and just wants to get on with it, I'll recommend her seeing a doctor for a potential surgery. And if we need IVF, we need it. I'll still do all my things because I still look at it as major prep work and really important to help her achieve a healthy pregnancy with a healthy child, and that her body has the goods to give this growing child, and we can reduce inflammation with all of these techniques. So we put her in a better position to heal and recover from the surgery. But I am not one of those practitioners that's anti-Western medicine, and I really see the benefits. I also see the abuse of it. You know, I see a lot of girls go into fertility treatments that don't need it, that were impatient and just wanted to push things along and were a bit controlling, and, you know, bless them, and that's what worked for them. But there are this subset of patients that I tend to work a lot with. I have a lot of these autoimmune cases that they do well when they also take steroids and a blood thinner, and then follow my autoimmune diet, and also take the supplements and get acupuncture and do my massage and castor oil packs, and follow the lifestyle recommendations, plus are working with the reproductive endocrinologist, immunologist, which is a little different than the regular REs. So anyway, structural and anatomical blockages. One thing that is great for this, if you suspect it, is castor oil packs, Mayan abdominal massage, acupuncture, Chinese herbs for certain. And if a woman hasn't had a workup and she's been trying to conceive, I would urge you to say, okay, you need to get to a doctor and get a vaginal ultrasound. Someone needs to look in that uterus, make sure there's no fibroids or cysts, or do an HSG, a histosalpingogram, and get to make sure that those tubes are open. Otherwise, we're just trying in vain, right? And I'll get to it shortly, but, you know, if everything seems fine with her, then, and sperm hasn't been checked, sperm absolutely needs to be checked. There's a male factor. I think it's 25% of the cases now. So, you know, that's another area to go to quickly. So PCOS, you'll see a lot of this. There's probably a handful of you listening that have it. PCOS is the most common fertility challenge in the United States. It affects approximately 20 to 30% of all women with fertility issues. It's a hormonal and metabolic imbalance in the body. So usually too much testosterone and estrogen and some insulin resistance. There's some controversy over whether or not PCOS is an autoimmune condition. I kind of couple it in because it has a lot of, obviously, the type 1 diabetes kind of traits. A lot of women with PCOS, you know, their A1C is high and they're looking like a diabetic patient. You know, sometimes these women don't present with the classic PCOS symptoms, which are like facial hair and, you know, heavier body types, like kind of rough, ruddy skin, acne, you know, hair growth on their neck and their breasts and their face, patches of hair loss. That's kind of like the classic symptoms. There's what they tend to call, which, you know, it's not my term, so don't judge me, the thick type or the thin type. So that's more the thick type. And then the thin type is, these girls present pretty normal and they pretty much have, you know, kind of regular-ish cycles. They don't have a lot of the insulin resistant symptoms, but you'll see it. These are the girls that tend to get those, a couple surges on the predictor kits, or if they're doing BBTs, they get a couple surges before they actually ovulate, surges of LH, that is. I am talking, assuming you guys have a basic level of knowledge of female hormones and stuff, so I apologize if that's going over some people's heads. I don't think it is, though. You know, so you kind of really have to pay attention of like, is this PCOS? Again, not so sure the diagnosis matters that much, but you do want to think about blood sugar regulation, you know, so these girls really need a protein-rich diet. They really need to watch, you know, the refined carbs and alcohol, caffeine, you know, that kind of stuff really can set them off. So, you know, you'll see it in that like hypoglycemic, the girls that get the real hangry episodes, the blood sugar episodes. So they might not have all those classic PCOS symptoms, but they still might have these delayed ovulation. Endometriosis, which it's the second most common cause of fertility issues, another 20 to 30%, I think sometimes even 40%, because there's like silent endometriosis, then there's real classic endometriosis. It occurs when the cells from the lining of uterus grow in other areas of the body, such as the ovaries, intestines, and fallopian tubes. And then with each monthly menstruation, this endometrial tissue responds to the fluctuation in hormones, can cause menstrual pain, internal bleeding, heavy bleeding, scar tissue buildup, blocked tubes, difficulty conceiving. Endometriosis is usually the most common cause of the anatomical and structural issues, like I was talking about before. So some women have very severe symptoms. There's like a saying, you could have, a woman could be covered in endometriosis and have no symptoms. She could have a tiny little blip of endometriosis on her cervix and have like the worst periods of everybody. So the symptoms do not convey the extreme of the disease, if you will. I typically see in these women, they tend to have habitual miscarriages as well. They kind of go hand in hand. And that's, if I see, I'm going to get to miscarriage in a second, but if I see a woman with more than one miscarriage without a live birth in between, I automatically refer her out to reproductive immunology. I have it at the end in the resources, but there's a really good book called Is Your Body Baby Friendly? And that is basically about what happens with the immune system and endometriosis and habitual miscarriages. So for some of these women, laparoscopic surgery might be necessary. We don't really know. The thing is with endo, you can't diagnose it unless you go in with a laparoscopic surgery. So you got to go in through the belly button. You can do a pelvic MRI, but not all insurance companies cover that. But again, and I'll get to this in a second. So miscarriage is the next thing that I put in my top 4, right? 1, 2, 3, yeah, 4. Whatever it's called, the ASRM, the assisted, or whatever it's called, this reproductive medicine council type of people don't necessarily recognize this, but this is something that you will see a lot of. And I think if you see more than one miscarriage or girls having multiple chemical pregnancies, so basically they get a positive pregnancy test and then like 3 days later they start bleeding, you want to think autoimmune, and you want to think of it right away. And there are a lot of tools that we have in the natural world to help these cases, but I also will recommend a full workup on any of my cases. So autoimmune diseases are at the root of most of these fertility challenges. So if you look at, I forgot to put premature ovarian aging on here. So POA is another one. Did I put it? No, I forgot. Oh, I put it in here. And PCOS, most think is an autoimmune condition. Endometriosis is absolutely an autoimmune condition. Habitual miscarriages, there's definitely autoimmune link here. POA, which stands for premature ovarian aging, or they also call it premature ovarian failure, POF, which is just a terrible name, because you can reverse that. For a lot of women, I have like one that just gave birth, who was told, and she's a physician, she was told 2 years ago she could never have children. Her FSH was like in the hundreds. And yeah, she got pregnant naturally last year. She just had a baby. So there's that. And I'll get to that in a second too, but premature ovarian aging is another. They've actually found now in the body antibodies to the ovaries, which could then potentially trigger this autoimmune type of condition. So let me define what autoimmunity is. So basically autoimmunity, you guys probably know this, but is when the body starts attacking its own tissue for unknown reasons. So what in Hashimoto's, it's the body attacking the thyroid. Most girls that I see that are dealing with fertility challenges either have Hashimoto's or celiac or both. When I wrote Yes, You Can Get Pregnant, I interviewed the head of reproductive medicine at Yale, and I told him my theories on this autoimmune link, and he said, you're really onto something. He said, what we're doing here is we're screening every single girl these days for Hashis and for celiac, because we're seeing such an incidence in this population, meaning the women trying to get pregnant. And then that leads back to the endo and the PCOS and the premature ovarian aging and the miscarriages for certain. So autoimmune disorders result from a problem with your immune system. Normally, your immune system acts as a protector against foreign invaders, such as germs, bacteria, viruses, attacking these foreign invaders to keep you healthy. However, when someone has autoimmunity, the immune system goes amok and starts attacking non-foreign body parts, tissues, and organs. Autoimmunity, when activated for any reason, causes your entire body to be inflamed, stressed, and hostile. Presenting symptoms, I mean, there's a lot of potential symptoms: fatigue, muscle pain, muscle weakness, inflammation, susceptibility to infections, weight loss, weight gain, low blood sugar, blood pressure changes, candida, yeast infections, digestive problems, like pretty much everything we see, skin rashes. So I kind of have this rule of thumb, like, girl comes to me, she's trying to get pregnant, she's not getting pregnant, she has GI issues, gas, bloating, indigestion. She has skin issues like eczema, psoriasis, maybe headaches, maybe joint pain. I kind of automatically think, I don't necessarily say she has an autoimmune condition, because I don't want to like overdiagnose people or improperly diagnose them, especially without blood work. But I automatically think, okay, there's a lot of inflammation in this body, and that's why she's not getting pregnant. So it's a little detective work, but you'll see as you're out there in clinical practice, you'll start to see these consistent presentations. Hashimoto's, so let me go through this and I'll get back to it. Other causes not commonly spoken of, obviously the male factor. So sperm should be checked, and I think within 6 months of trying, if nobody's pregnant, sperm should get checked. Urologist, or talk to the general practitioner, but sperm should definitely be checked. And I also think that the protocol we put our clients on, our female clients, should be followed as much as possible by the male partner. Not everybody's in a male-female relationship, so obviously that's different. Those people that are not in heterosexual couples are going to need fertility treatments, but you'd still do the same type of protocol. And I have a lot of same-sex couples, mainly women, that I'll work with, because the men don't really, if they're same-sex men, they don't really need me. They need a woman with eggs and a surrogate. So I usually am left out of that equation, but maybe I'll work with the surrogate sometimes, or the woman giving the eggs. I've kind of done everything at this point, I think. But in same-sex female couples, I really like to work with both the women too, because I do think from an energetic perspective and just how they can support each other through it. So I do think it's always really important, especially if this becomes like a specialty of yours, that you really try to involve the partner, whatever sex they may be. So male factor, post-birth control syndrome, this is not talked about enough. I think it's getting a lot more publicity these days, but most women are on the birth control pill from like 16 to 32, then they go off and they think they should be able to get pregnant, next month. And that doesn't usually happen. The birth control pill literally just shuts down the system. I kind of look at it as it's like a little rusty. We got to kind of like WD-40 it and get things working again. And the science out there shows it usually takes between 3 to 6 to 9 months for normal ovulatory function to restore itself. So, these women you really want to support, I guess almost helping their body clear out the synthetic hormones, getting everything back in balance. I'm an acupuncturist, so of course I'm going to say this, but I really love acupuncture for restoring normal ovulatory function. Another cause that I think really impacts fertility challenges is what I call honey, I'm ovulating sex. So a couple that only has sex when she's ovulating, and it's like forced time sex. Not super fun. As I say a lot in everything I write and talk about, is babies are made out of love. Even if you're doing IVF, babies are made out of love. So that relationship should be worked on. And even if you're doing this on your own, babies are made out of love, So, and I talk about this in a later slide, but getting back into the joy of things. And then trauma. I think, I don't know everybody's scope or training, but if I sense trauma or someone talks to me about a history of trauma, whether it's sexual abuse, emotional abuse, just abuse from, you know, parents, and they're afraid to be parents themselves, I really try to enlist psychotherapy to get them to work through some of that. Because, you know, one thing I always say is my job isn't really to help you get pregnant. My job is to help you become the best version of yourself, so you can be the kind of mother this world needs and that kid needs. And, you know, I really take my job seriously from that perspective. And so if I sense some unworked through trauma, I really encourage that. And I encourage that for all of us too, to be the best practitioners we can be. We got to work through our stuff, you know, be the example, be the role model, and, you know, do yourself that service, because then you'll be in more service the more you work through your own things. But so those are things that I think really keep an eye out for, and also, you know, to not underestimate the trauma of the trying to get pregnant process. If you get someone who's been in the path of trying to conceive without success, that in and of itself is extremely traumatic. And so other healing modalities that they may need, you know, whether it's spiritual or psychotherapy or you know, journaling, meditation, all of these types of things to really start to help reset the nervous system. Because again, going back to what I said in the very beginning, if the body doesn't think it's safe to make a child, it won't. And if your nervous system is firing like, you know, bonkers, or still in a trauma response or PTSD, it is challenging to conceive. Not to say women don't do it, it happens, of course. But we are seeing a real increase in fertility challenges, and I think we can't overlook these things either. Okay, what's going on here? Okay, sorry. Okay. So advanced maternal age is another thing that everybody talks about. I think I kind of touched upon this already, you know, the truth about your age. I just want to make sure. Okay. You know, age has something to do with it. Sure, ovarian reserve declines as we get older. The environmental impact is more intense the more years we're exposed to a toxic environment, and stress and sleep deprivation, right? So those things we know age us, and of course they will impact quality of our health. But age is not the biggest factor in this whole conversation. That, you know, you fall off this fertile cliff at the age of 35 is just, it's fairly bogus. And, you know, again, I think we have to look at health overall, not just fertility, not just numbers, not just age. These are pulled from my book, which was written in 2014. So there's probably newer stats now. 82% of women aged 35 to 39 having sex twice a week conceive naturally within 1 year of trying. And only to 86% of women younger than them. So not that significantly different. 78% of women 35 to 40 who had sex at their fertile times got pregnant within 1 year of trying, compared to 84%. So it doesn't, we do not fall off this fertile cliff. It is not, basically they're saying that only 60% of women will get pregnant over the age of 35, and that in 1 year. And that's obviously not true, just from these two studies. So, you know, I think another thing I run into, I co-treat a lot, you know, whether it's nutritionists or functional medicine doctors and other acupuncturists or herbalists. If you don't believe in your client's ability to get pregnant, but this client wants to get pregnant, don't treat them. Send them to somebody else who believes in their ability. Don't put your fears and worries and traumas on them. You don't have to ignore reality, if you will, or perhaps science. You know, if I have a 48-year-old and she comes to me and says, I want to get pregnant naturally, I'm very honest with her. I'm like, well, okay, well, I don't, you know, tell me where you're at. What are the stats, you know? And I would encourage fertility treatments at that point, and also talk to her about donor eggs. If I have a 45-year-old, I think there's still a shot. Basically, if you're menstruating and you're ovulating, there's still a shot. menstruating and ovulating on a regular basis, and we're looking at like a healthy cycle, right? We're seeing all the things we talked about in the beginning. But I do think it's important that we hold space for our clients, and not judge them and not put our things on them. We can be honest, we can be real. But if you, I have a thing, if I don't see it for a woman, I refer her out. Not my case, it's not fair to her if I don't believe in her ability to do it, and she still does. That's not fair. And I know there's a fine line between being responsible or not, but to just really take inventory of yourself before you make judgments, or why are you making these judgments. Age is not the biggest factor. Diet, lifestyle, managing autoimmunity all have the largest impact on fertility and the ability to conceive. Chronological versus physiological age. I think you guys probably know about this in epigenetics. But I often say I can have a 45-year-old who has better hormones and probably better egg quality than a 35-year-old. It just depends on how she lives her life. I could say for myself, I'm healthier now than I was in my early 30s for certain. And I definitely think that has an impact on my hormones, my health, my fertility, all of these things. And so to try to look at our clients like this physiologically rather than chronologically, right? To not get caught in that mindset that, oh, you're 35, okay, these are your odds, right? Or you're 45, these are your odds. These are all fertility markers: follicle stimulating hormone, AMH, anti-Müllerian hormone, and AFC, antral follicle count. These are all measurements doctors will take. FSH and AMH is blood measurement. Antral follicle count, they use an ultrasound to look at the ovaries and look at how many follicles they see. These are tools that doctors will use to tell a woman about her ovarian reserve. Two things to know. Ovarian reserve does not mean anything when it comes to ovarian quality, right? There's not a single piece of science that supports decreased reserve means poor egg quality. There's a lot of talk out there about older women, poor egg quality, poor reserve. So high FSH sometimes indicates that egg quality might be declining, but not necessarily. And so, a woman, they used to say you're only as good as your highest FSH. So if a woman's FSH is over like an 11, some fertility clinics won't work with her because she's not going to get a good response. And that becomes this number she has to wear. It all of a sudden starts defining these women. My FSH is high, I have poor ovarian reserve, I'm never going to get pregnant, right? It creates this very sad story for them. And I've seen FSH change. I see it improve. AMH is newer to the market, if you will. They started using AMH. It's a hormone secreted by the ovaries. So FSH, as we've learned before, is secreted by the brain, which triggers the ovaries to grow the follicles. AMH is secreted by the ovaries themselves and gives us an indicator of ovarian reserve as well. You kind of want to see an AMH around a 1. Or higher, depending on the age of the woman. Anything below a 1 is considered not great, for ovarian reserve again, and then another label. Basically, these numbers, and then antral follicle count is they'll look at your ovaries and they'll say, oh, you have 4 on one side and 6 on the other. Anything really over an 8, when you add up the two, is a decent antral follicle count. So you really should take all 3 into consideration when you're talking about ovarian reserve, or what the woman's timeline is. But also to remember that these will change cycle to cycle. They're not set in stone. There's a lot you can do to improve the quality, these numbers. But that it's really not about these numbers. It's really about, because I just try not to even pay attention to FSH or AMH. And again, not from an irresponsible point, but because I've just seen it change so much, month to month in different girls. And I've seen girls with really low AMHs and really high FSHs get pregnant with beautiful, healthy children. So I don't give it that much credibility. I think where it really is important is if you're doing fertility treatments, because it gives the doctor an idea of how well you're going to respond to their medication. But if you're trying naturally or you're doing more natural fertility treatments, there's a lot of clinics that do IVFs with very little drugs, you know, and there's a lot of docs that are really good at working with women with high FSH or low AMH. So, you know, it's really about finding the right doctor for them if they do need fertility treatments. But they're not the only thing. You can still get pregnant if these numbers aren't great, and they change. So this brings me to part 3, which is probably where the juice is for you guys. It's about quality, not quantity. So those numbers, FSH, AMH, antral follicle count, tell us about quantity. How many eggs do you have left? And again, when we're talking about poor ovarian reserve, we literally have no idea how many eggs she has left. It's probably in the hundreds or the thousands. It's not like 1 or 2. I remind women of that because I do think, you know, the longer I've been doing this, I do obviously practice in energetic medicine. I've become a very spiritual person myself over the years. The weight you give these numbers and this information really does impact, and I wrote a whole book on it called Body Belief about what you think impacts your physiology. There is science out there to support it. Our thoughts are literally neurotransmitters, which then literally turn on and off physiological function in the body. They impact cellular health. So if you are walking around thinking, I am broken, my FSH sucks, I'm never going to get pregnant, you might very well just create that environment in your brain. So I really try not to pay so much attention. Those numbers can be useful, but I try not to pay that much attention to the FSH and the AMH. When they're good, they're good. Sure, that's awesome. When they're not, I try to really get my client to focus on what is working in her body and the things we are improving, and know that FSH and AMH can improve, antral follicle count can improve. So just to not get so fixated on that. How do we improve quality? And quality, when I'm talking about quality, I'm talking about quality of eggs, egg quality. It really does start with the egg, as a book out there is called. It's called It Starts with the Egg. And it really does. The egg is, I think, 10 or 20 times larger than the sperm, maybe even more, 100 times larger than the sperm. It's huge in comparison, and it contains a lot of the data we need to procreate. And so, but I'm also talking about quality of uterine lining, quality of reproductive health, quality of, you know, if we can improve the quality of the cells in your ovaries, right, which are the eggs that are inside the follicles, which are inside your ovaries, we can improve the quality of every single cell in your body, which is the stuff we know, right? That's what you guys are learning, like epigenetics. We know, like cellular detoxification, mitochondrial function. If we can improve the quality of those cells, we can thus improve the quality of the uterine lining. We can improve the quality of the eggs. We can improve the quality of how her body absorbs nutrition, how his body absorbs nutrition, right? So, and it comes down to these, I think, 4 crucial pillars. Nutrient dense diet, minimize toxins. So you guys have a handout for, I think, the most common toxins in our bath and beauty and household products. And then maybe there's also some other approved products in there. I can't remember all the details of the handout, but environmental toxins are playing a critical role in not just fertility or autoimmunity, but everybody's health right now. They say the average woman is exposed to 500 chemicals before she leaves the house in the morning. We've got to get that load down because those are endocrine disrupting chemicals. So that means they're disrupting hormones, and it is going to be, and if you do get pregnant in that circumstance, it just is not setting the stage for a really healthy life for that child. The research is out there. It's kind of scary. You know, and so, you know, that goes down to the plastics and the parabens and all of these things, but we really have to minimize the toxins. It said that since the 1980s, we've increased over 100,000 chemicals we've introduced into our environment. And most of them are in our bath, beauty, and household products. So we're ingesting them, we're breathing them in, we're putting them on our skin, we're, you know, rubbing them all over our bodies. We have to minimize the toxins. manage lifestyle. So those are some of the things I talked about, like the sleep and, you know, enjoying your life. And if you're trying to conceive, that you're having fun sex, even if you have to do IVF, or, you know, maybe even if you're doing it alone, you know, whatever it is, enjoying your life, getting out into nature, managing your stress, meditating, exercising, listening to your body, slowing down, and then managing autoimmunity, which really the top three things are what help manage the autoimmunity, but I'm going to get into it a little bit more. The joy factor. I put this in because I didn't want to forget to talk about the importance of actually enjoying your life while you're doing all these things too. I often joke with my clients, like, I'm going to put you on a really strict diet, and I'm going to put you on these supplements, and I'm also going to tell you that I want you to enjoy your life. And they're kind of like, screw you, I really miss gluten, you know, I hate taking all these pills, you know. And it's, but how I get them back to that is like, I want you to celebrate how good you're feeling. I want you to celebrate the changes in your body. I want you to see the shifts that your body is making, and celebrate that, and then also get back to living again, right? So I deal with a lot of women who've been trying to conceive for a very long time. You know, whether 6 months or 6 years is a long time to any of those people, right? It's too long. And they literally put their life on hold. They put travel on hold. They put changing jobs on hold. They put working on their relationship on hold. They put moving on hold. Everything gets put on hold. And they are so unhappy, and they are so sad. And they get that I'll be happy when mentality. I'll be happy when I get this child. And that is not a way to live your life. So for any of us, the I'll be happy when does not work. And if you need work on that, you know, I have some recommendations, I think, towards the end of the book. But I love people like Deepak Chopra or Gabrielle Bernstein or Wayne Dyer, Abraham Hicks. Those are kind of my peeps for this joy factor conversation. Even myself, I think I talk about it a lot as well. But to make sure, and it's not always in our scope, but you will be doing intakes and you are spending time with your clients. And so to, you know, what are you doing that's fun in your life? What are you doing that excites you these days? You know, and how can we make food exciting? How can we make nutrition exciting? How can we make supplements exciting? How can we make lifestyle exciting? To not forget about the joy. And then this is probably something you guys want to know more of, ideal macros for fertility. It really depends. I just finished reading Deep Nutrition, which I really recommend that book. She says almost up to 60% for, you know, ultimate health and vitality and creating symmetrical children. That's kind of her whole theory, that symmetry equals health, which it makes sense because cellular division, when it's properly dividing, creates a healthy child. But I tend to stay in the 40 to 50% fat range, 25 to 30% protein, 25 to 30% carbs. Just a real quick thing here on, I do not think intermittent fasting or keto are at all ideal for fertility. If I have a PCOS girl who needs to lose weight, get her into a healthy BMI range so I can help her get pregnant more successfully, yes, I will use intermittent fasting. And I might have her do more protein and less carbs, absolutely. But when we're strictly talking about fertility, they need to be eating regularly every 2 to 3 hours, and they need a lot of good quality fat, and they need a lot of good quality protein. I do not support veganism or vegetarianism. I just don't see the results I want to see with those clients unless they are really smart vegans and vegetarians, and they're soaking and sprouting their nuts and their seeds, and you know, they're getting in their good healthy fats. I still try to get them, if I can, to do fish and eggs at the very least. But I do tend to see the best diet be, you know, I wrote autoimmune paleo here, but what I really mean is like an ancestral diet. And I have my fertility plate right here that my team and I created. So obviously water, bone broth. I'm a big fan of bone broth. It's been a part of Chinese medicine for thousands of years. So even people who don't eat meat, they still might be open to drinking broth. It's worth a shot. broth to us in Chinese medicine is like the glue, the baby glue is what I call it. But it is literally, you know, I heard Thomas Cowan, if you guys don't know the Weston A. Price Foundation, you should know about it. He's one of the heads there. He said once, if you want to make a human life, like basically someone was trying to pin him down about a fertility diet, which he just did not want to give the answer to, because he was like, there's no such thing as a fertility diet. You just have to eat a good quality diet with good quality fats and protein and a lot of vegetables. And that's the fertility diet, you know, but that's basically everybody's diet. He just said, if you want to make a human structure, you have to eat what structures are made of, and they're made of protein and fat and water. And then he joked and he's like, and throw in some vegetables. And that is, you know, how I was trained too from a Chinese medicine perspective. I've, of course, learned a ton over the years. I really subscribe to the Weston A. Price model, if you will, of ancestral diet and nutrition. I see it work the best, you know, when I reintroduced organ meats in my recommendations, which I tend to do in pill form because a lot of people don't like to take organ meats in food form. I really saw fertility go through the roof in my practice. You know, we're not eating organ meats, we're not eating enough fermented foods. So you'll see this plate. It's mainly veg, 3 to 4 ounces of protein, healthy fats, some fruit, lots of water, and some bone broth. And there you have it. I do have, you know, specific diets outlined in my books, which you could check out, but I think this is kind of self-explanatory. Lots of leafy green vegetables, but I do support, you know, eating the rainbow. Obviously, there's a sweet potato there, there's beets, there's carrots, you know, the avocado for the healthy fats, animal protein. It could be eggs, it could be fish. You know, I of course recommend more fish than meat. You know, I think in my book I say 6 to 8 servings of fish a week, 3 to 4 of meat a week, eggs, you know, 10 to 12 a week, and then obviously upwards of 6 to 8 servings of vegetables a day, ideally more cooked than raw. Chinese medicine, we say too much raw really slows down the digestive system, and it makes for a cold uterus. So we like a warm uterus. We like warm cooked foods. Obviously everything in moderation. I think the 80-20 rule, but there's very little grains on this plate. You can see you could do some good fermented sprouted grains, you know, like a good sourdough bread, especially if someone doesn't have celiac. I also think most people, you know, there's people with celiac and there's people with gluten intolerance that are probably intolerant to the pesticides as much as they are to the wheat, or maybe more to the pesticides. But you know, if I don't have a patient that has dairy issues or gluten issues, I'll let them have it in moderation, organic, full fat for the dairy, and of course sprouted and organic for the wheat. Okay, the most important supplements for fertility, again, omegas. If you're dealing with someone with autoimmune conditions, you want to think about like 2 teaspoons of fish oil a day, which is like 4 grams. It's a lot. 3 to 4 grams a day of fish oil will really help lower inflammation. And there are some research studies that show if you lower that omega 6-to-3 ratio, meaning more omegas to 3 to 6s, pregnancy outcomes improve. Probiotics. I am, of course, a huge fan of getting most of our nutrition through food, but we all know our soil is pretty compromised these days, so we do need to supplement. Vitamin D, oh, you got to get a woman's vitamin D levels checked. I don't know where my lab things are. There they are. Okay. Vitamin D needs to be up to 50, between 50 and 70. Prenatal or spirulina. I kind of use both interchangeably in my practice, just depending on the patient and the needs. Methylfolate, not folic acid. So we'll get into that conversation in a second. Mitochondrial support. So something like a CoQ10 maybe, or I like Mitocore by, I can't remember, Zymogen, I think. Antioxidant support. Again, that could be, the spirulina is a great antioxidant support. Good healthy diet is a great antioxidant support, but maybe something, you know, like glutathione or alpha lipoic acid. It just kind of depends on the patient, their needs, where they're at. If you're doing any of these functional testing, so you could see where they're deficient. Magnesium, super important. I use it in the spray form typically, and organ meats. And I put organ meats on the supplements because most people don't like to eat them. So what I put basically everyone on when I first meet them is omegas, probiotic, vitamin D, depending on their levels, magnesium, organ meats, and then the prenatal, methylfolate, mitochondrial, antioxidant support, all kind of depends on where they're at. Every woman should have about 800 to 1,000 micrograms of methylfolate if she's trying to get pregnant. Needs to be methylfolate because, 50% or more of us have the MTHFR mutation, which you guys have a handout on what this is, so I'm not going to spend time getting into it. But that mutation prevents us from taking folic acid and making it into methylfolate, which then we can use, which helps the baby grow and develop. The most important lab tests for fertility: thyroid, progesterone, vitamin D, MTHFR, and other clotting factors, sperm analysis. Thyroid can be tested really at any time. You want to make sure you do a complete thyroid panel. That includes thyroid antibodies, free T3, free T4, TSH. Progesterone needs to be tested 6 to 7 days after ovulation, and it should be above a 15. Vitamin D should be 50 or higher. MTHFR and clotting factors is basically a panel I'll recommend women get if they have had more than one miscarriage. That's something a hematologist can do. You can just have them get a referral from their GP to a hematologist, and they can get that looked at. Sperm analysis, fairly self-explanatory. Right, the thyroid is one of the most important pieces here. So for those of you that don't know, if thyroid antibodies are present, they have Hashimoto's. That means they have an autoimmune condition. That means you got to treat them like an autoimmune patient. And that means with thyroid, especially, which is a whole other lecture in and of itself, no gluten, no dairy, no soy, across the board, hands down. The thyroid, when it has the antibodies, hates all three of those things, and you should not eat them. I just say to people, you have to act like you have an allergy to gluten, dairy, and soy. And again, like I said, most of my clients will come to me. They've been trying to get pregnant. They may or may not have been diagnosed with hypothyroidism, but when you look further, they have thyroid antibodies. It's probably, I'm going to guesstimate, 70% of my cases have Hashimoto's. And 70 to 80% of them do a hell of a lot better when I take gluten, dairy, and soy out of their diet. And I put them on the fertility diet, and I give them some, the anti-inflammatory kind of lifestyle, and that's it. It'll change, and they'll get pregnant. Part 4. So when I wrote Body Belief, my latest book, kind of came up with this three-step process to managing autoimmunity. Step 1, reconnect. Step 2, renew. Step 3, reawaken. So what do I mean by that? Reconnecting, and for the sake of time, I'm going to let you guys, if you want to dive deeper into this conversation, you can check out Body Belief. It's actually, I have a program I'm running right now at the Well, and Hay House put the ebook on sale for $1.99 on Amazon. I'm not trying to obviously self-promote right now, but I'm just telling you, if you want to read the book, because it goes really deep into autoimmune stuff, it's only $1.99 right now, for like the next month or something. But so listening to your body speak, right? That is the first pillar. So what I say in the book, and what I really think, and how I started this lecture and kind of how I'm ending it, is our number one job is we got to teach people to live in their bodies again. We got to teach people to hear what their body is saying to them. I have a headache because I didn't eat breakfast and I had 2 cups of coffee, right? I haven't pooped in 3 days because I'm just eating bagels, like whatever it is, or I don't exercise, or, I haven't eaten a vegetable in 3 months, or I'm so stressed out. And when I'm stressed out, I get constipated, whatever it is, that we get them to reconnect and live in their bodies again. Because I could tell you what to eat. I could tell you how much to meditate. I could even give you guided meditations and exercises and supplements and the whole thing. But if you don't live in your body, how do you know it's going to work? How do you know what feeling good could even feel like? Or if you aren't connected. So the reconnecting, to me, is one of the most important pillars. I make the argument in Body Belief, which is, scientifically backed, and it's also, though, energetically backed, if you will, from a Chinese medicine perspective, and I think from a spiritual perspective, that if autoimmunity is the body attacking itself on a physical level, where are you attacking yourself on an emotional level? And the only way we can really connect to that is we got to live in our bodies again. We got to start to hear the conversation we have with ourselves in the privacy of our own mind. That conversation it has been shown scientifically to impact our cellular health and our physiology. If you are constantly in a state of emotional inflammation, that's what I call it, where you're basically just bickering with yourself all day long, or telling yourself how terrible you are, or that you made a terrible decision 10 years ago and you've never let yourself let it go, your nervous system is on fire, your level of inflammation is very high, and it's going to be really hard for your body to rebalance. So the reconnecting is super important. And then it goes with the renew, which renew is about renewing the beliefs you have about your body. That's why the book is called Body Belief. And it's about managing your mindset. So I literally give tools in the book of, like, if this is what you think, this is how to shift it. And it's not about going from black to white. I think it's just going a little gray to a little less gray to a little less gray to a little less gray to a little more white, right? It's saying, you're terrible, you stink at this, to, you know what, you're learning. You're getting better every day, or you're better now than you were last year this time, right? So it's literally working on that mindset piece, and basically calming that hostility, because that's basically what autoimmunity is. There's a hostility in the body. And then the third pillar is Reawaken, which is where all the goods come in, all the tangible stuff, the diet, the mindset, minimizing the toxins, the supplements, right? So you take all three of those together, and you really have a good formula for helping someone achieve thriving health. And again, when they're in thriving health, they should be able to conceive if they're a woman who's regularly menstruating and ovulating, even if she's 45, 46. I've had 46-year-olds get naturally pregnant. I've had 47-year-olds use their own eggs, doing IVF, carry babies to terms. Those are my oldest. And I have plenty of 45 and 44 and younger who get pregnant naturally or with fertility treatments. And of course, women in their 20s and 30s, but you can do it. It's, I think you have to look at this whole system as a whole, holistically. And I also think you have to realize that as we age, the biggest thing is, like, these toxic burdens, whether it's stress or environment or poor diet, does catch up with us. So we have more work to do. It's not fixable. We just have to put a little more effort in. You've got to create an optimal environment for fertility. If the body does not feel it has the goods, it will not prioritize conception. That is it, plain and simple. And as I said, I think a handful of times here, fertility is an extension of health. If you're helping a client get pregnant, your only focus should be optimal health. Let's see what else. And keep in mind, optimal health is mental, it's emotional, it's physical, and it's nutritional. And lastly, I think this is my last one. Yeah, the female body is wired to get pregnant. Its fertile parts know how to work. We just may need to remind them a bit how to do it, basically. So you're looking at the system as a whole. And how can I best support this system in its proper functioning so that we can have an abundance, an overflow of substance, of energy, of reserves to create another life. And then refer out for mental, emotional work. Never underestimate the power of the mindset. I think this is important to remember. If diet and supplements aren't working, the mindset needs to shift. I have girls all the time, they come to me, I've been following the diet, I'm taking all the supplements, I'm still not getting pregnant. And, I've been doing this a long time. I have a lot of comfort and I think experience in working on the mental, emotional piece, and a lot of spiritual tools to do so. I'll coach with them, but I'm usually referring them to some therapy as well, or something like that, whatever speaks to them, but to work on the mindset piece. I had a girl in tonight who I've been working with for probably a year. She's perfect on the diet and she's perfect with the supplements, but she's just so tense around whether or not this is the month she's going to get pregnant. And her ovulation is always a little delayed. It's like cycle day 21, 22. I can't quite figure out why I can't get it to budge up. Sometimes 23, 24. And I had her work with this mindset coach who I actually work with. And he's been having her just kind of see the joy in her life, to celebrate and joy, doing all the right things to support herself, feeling good about it. Not when am I going to get, not if I'm going to get pregnant, but when. And, it's okay if it's not this month. And she's really done all this mindset work. She also had a lot of trauma as a kid. Her dad was murdered. I mean, and she just never really unpacked it. He's helping her unpack that. And literally this month, where she just basically planned out her entire year with travel and fun. I'm just going to have fun with my husband, and we're going to spend money, and we're going to travel. She ovulated on cycle day 14. I haven't done a different thing with her. The only thing that's different is her mindset. And I think I've been supporting her nutritionally and physiologically for her body to be in the right place to shift. But like all of a sudden this month, boom, just jumped right back into normal. And you know what? We joked tonight. I said, maybe you'll get pregnant tonight, this month. Who cares? But she's like, but you know what? It's okay if I don't, because I'm going to have fun this year. And she's in her, 33 or 34. She's like, I'll be pregnant in my 30s with my first child, and I'll have more than one child, and this is going to be okay. But she literally worked on her mindset. I do think the nutrition and lifestyle is crucial, right? I've been spending time getting her there, but the mindset piece was another last shift. So to never underestimate that. Here's some resources for you guys. The first two are my books. Deep Nutrition. I love this book. I think Catherine Shanahan is her name. These are books that really impacted me from a nutrition perspective. Healing with Whole Foods, which you guys probably know. Nourishing Traditions. That's the Weston A. Price book. Paleo Approach, Sarah Ballantyne. It's a great book, talks all about autoimmunity. So if you want to really know the science and like nerd out, that is the book. And Is Your Body Baby Friendly? So if you're really interested in that autoimmune fertility component, that's the book. And I'm doing an update on Yes, You Can Get Pregnant, that I'm going to add in a lot of the autoimmune stuff as well, but that probably won't be out for like a year. And then you guys can find more of me at aimeeraupp.com. I don't know why there's a space there, but it's all one word. And then, I guess we can open up to questions here.
Absolutely. Thank you so much, Aimee. Really good, comprehensive presentation here. So some beautiful gems that you shared.
Thank you.
So yeah, I just wanted to reflect back a few things as questions are coming in. You mentioned Chris Masterjohn early, and we are familiar with him and his terrific work, and students have access to him. He's also done webinars for us in the past.
Oh, really? So, I love to hear that. Okay, great.
Right. So anybody that's listening can search Masterjohn in terms of author of a presentation or his talks on vitamin D, etc.
Yeah.
Mm-hmm. And then also just in terms of the books, many of the books are on that, definitely Shanahan on Deep Nutrition is a fabulous book. It has been on our curriculum for a number of years. Unfortunately, we're accredited and bound by, we can't have anything older than 5 years on the curriculum, right? So there's what's determined.
You don't have like the Weston A. Price stuff, probably.
Weston A. Price, we actually have an entire master's program, the Master's of Science and Traditional Nutrition, on Weston A. Price's work and function. So yes, we're familiar with it. We believe in it. We teach it.
Right. So the diet, I feel like, is so known to all of the students then, which is just great. I mean, I think we need more of us out there, like preaching this ancestral style diet.
I agree. We have lost so much of our health and vitality by veering from that, and certainly into the deficient standard American diet. It's just pathetic. Also, another thing you mentioned about organ meats and people not liking it. We have a graduate, Autumn Smith, with a company called Paleo Valley. And she makes,
I have her bone broth, or her bone marrow one, right? Is that her?
Yeah, exactly. So she has a product called Organ Complex. She also makes a fantastic protein bone broth powder. So those are a couple of things to check out.
Great.
Okay, question. Something, came in early about castor oil packs and abdominal massage. So
Yeah.
we're real familiar with abdominal massage for constipation and feeling the shape and tenderness of an organ. But how would you, just briefly, how did you conduct an abdominal massage for fertility? What were you looking
Well,
for
I
specifically?
don't do it. There's specific training. It's called Avrigo, Avrigo, Avrigo Mayan massage.
Okay.
But it's similar to the organ massage, but they're feeling for like the uterus and the ovaries, and really it's just what I see it as, it just helps increase blood flow and circulation to the uterus and the ovaries.
Mhm.
And I'll tell you, it's a great way to improve the AMH too. If you're
Right.
worried about that hormone level, because you improve ovarian blood flow, you'll improve ovarian function.
Mhm.
And a lot of the Arrigo massage therapists love castor oil packs, and we use them a lot too in Chinese medicine. And I have a YouTube video on how to do it, but I'm sure you
Great.
guys are familiar as well. But I'll recommend that quite a bit in the follicular phase, so the first part of the cycle leading up to ovulation. Once they've ovulated and if they're actively trying, I do not recommend the Mayan massage or the castor oil packs, because they can be too moving and like
Sure.
dislocate, an implanted embryo basically.
Interesting. So with the castor oil pack, traditionally you would place it over the liver area with
You
some
place it
heat on
over
it,
the
so
uterus.
right over the
Mhm.
ovaries in this case.
Yeah, in the lower
Good,
abdomen,
good, good,
exactly.
good distinction there. I'm glad that this came up.
But you
There,
can do over the liver too. So like when I was talking earlier about like, is the liver not detoxing properly, or maybe
right?
they've been on a lot of medications, or you're doing like a real cleansing type of diet with them, or they've done fertility treatments, I will
Uh-huh.
do it over the liver too to help it
Okay,
process out, right?
beautiful. Um, there's a book. I'm wondering if you know about this book, Aimee. It's called Natural Birth Control. Was first published, I think,
Yeah,
in.
of course. Um,
Have you heard it?
yeah, that's like the
So,
family planning method, right?
well, it's not so much.
No.
This was the research was done by Czechoslovakian physician Dr. Eugene Jones, and just had incredibly reliable information both on when to conceive as well as the birth of the child. And in 1969, the British medical newspaper GP General Practitioner examined the data from this and reported that it was 99% accurate, and they validated it. He was, when a lot of things happened, he got run out of the country, and his whole research got shut down, and some of his associates that had worked with him still had pieces of his research, and so
Oh,
that's been put together. It's really interesting in that it's based on um, uh, fertile astrology. So his belief in theory is that we're actually fertile twice in a month, and the second one is when when we were born, the sun and moon were aligned in a certain position, and it realigns in that position every month. And during that time, that's when people can get pregnant when they're not, when they don't think that they're ovulating. Fabulous read. I
I'll have to
encourage
look
it.
at it. Yeah,
Picking
natural
it up.
birth control, it's called?
Yeah. Yes.
Okay. I don't know.
Um, yeah. How to choose the sex of your child, on the report on the work of Eugene Jones, and yeah, how to calculate birth control, sex selection, and fertility.
Huh. No, I'll have to look at it.
Yeah. Okay. Then we got to see. In part three, you were talking about um, the really key principles of nutrient-dense diets, toxins, lifestyle. These are the things we use as nutrition professionals to support everything. And so it was really curious to me that you dial into managing autoimmune and how challenging. I just think it's really challenging
Yeah, it
for a
is.
lot of practitioners to understand it and to really advise on it. I've seen just some crazy
Oh
protocols.
my God. Celery
Um,
juice. Yeah, that works. That works, right. Yeah, it's hard. I mean, I think like that it has to be almost that three-pronged approach. And I would say too that the really um, challenging cases I've had, it's like they really got to stay the course for a year to a year and a half, which can get really challenging and costly for supplements and
Right.
and the diet and all that. They do always feel just worlds better, and those are the cases too. Like those are the extreme endometriosis cases, the ones that they didn't get surgery because that wasn't kind of didn't align with their principles, and I'm totally supportive of whatever it works for them. Um, and they these cases did get naturally pregnant after multiple dozens of failed fertility treatments type of things, and I've been practicing long enough that I have the luxury to look back, and it's like this is they stuck to it for this solid like year to year and a half,
Right.
and they did all the things, and it was literally like they worked on that mental emotional piece, which is usually the hardest one, to be
Right.
honest. And then they did the diet and they did the supplements, and they really changed the lifestyle around. And you can't well, as far as we know, right? But maybe we can't cure autoimmunity, but we can manage it. So,
Yeah.
and I do see it too in labs. Like, in the one case, the girl was Hashimoto's, and her thyroid antibodies were in the thousands, and they were down to like the 90s, when she
Yeah.
conceived naturally. And it's not to say like other things don't trigger it, but what was really interesting, one of my cases, one who got pregnant, well, one of them who got pregnant naturally, I had her cut out nuts and seeds because she was still getting like some GI symptoms and some sinusy symptoms,
Hmm.
and
Hmm.
she was paleo-ish, but not full on. And I was like, we got to cut out the nuts and the seeds. And then when she got pregnant, and she was on an autoimmune protocol too, so with a fertility doctor, but did conceive naturally. And so he was checking her immune markers, and
Hmm.
there was a time where she was like, I need more calcium. And I said, why don't you do like a teaspoon of tahini a day instead of taking another supplement? And she's like,
Right.
okay. She hadn't had tahini in months, maybe
Uh-huh.
6 9 months. He was doing blood work, and he called her, and he was like, I might need to
Um,
increase your steroids. What's going on? Like, what did you change this last week? And she was like, oh
Interesting.
my goodness, I started eating tahini again. And I was
Uh-huh.
like, oh my, like, it's so interesting to me because I thought to myself, oh my gosh, so for the last 10 years, this woman probably has this low level, like intolerance or whatever you want to call it, to tahini. And that was triggering this immune reaction like every single time in her. Do you know what I mean? It was the simplest thing, and so benign to so many of us, but it was just such a good lesson for me because I actually had the Western doctor testing her immune markers, while I saw the diet change. And, it's just, to me, it really just spoke volumes of like, this stuff does work. And it really is I always say to my girls, consistency and frequency. It's the consistency and the frequency. And it's not easy to choose to live this way, but when you start to see how good you can feel, I just try to get them to remember that and get them to stay there. And then of course you can have your deviations, and you'll see, your body will tell you how it feels, it will speak to you. But it's challenging, and I think you need the whole approach. You really need to look at every single pillar,
Sure.
and
Every
and
pillar.
then also have hopefully a good endocrinologist or a really good functional medicine doctor that you could work with, and stay on top of it from that perspective too.
Right. But I appreciate so much you bringing in the mental, emotional piece and people's false beliefs, the things
Yeah.
that we repeat and repeat, repeat to ourselves over and over, and we're not even conscious of the things we say to ourselves anymore until it comes to consciousness, and then we have the ability to say, "Wow, I don't really want to be saying that to myself.
And it's
Do
really
I
triggering.
really believe it? It may be true, but do I really believe it?"
And how does it serve me, right? How is this serving
Exactly.
me?
Right.
So yeah, and I do think, as practitioners, we can lead on that. We do our own work, and we can really be even more transformative to our
I agree.
people.
I agree. Beautiful. So a couple questions come in about your book. They were talking about the book that's on Amazon, your 199 ebook. That was
Yeah,
Body
I don't
Belief,
need to be
correct?
salesy, but like legit, it's on sale for 199. You might as well go get it if you want to read it.
Right, right. But it was Body Belief, and
Yeah, body belief,
and
right?
this was the one you were referring to has a lot of autoimmune
Body
content,
belief is
and it
all
is right.
autoimmune. Yeah.
Right.
I talk about autoimmunity, and yes, you can get pregnant, which was definitely like a bit before its time because we weren't really talking about it in the fertility community. But I don't go into it as much, so I want to revise the book and get into it more.
Right. Beautiful. Thank you. I'm glad to know. Let me know when you have an update. I'll tell everybody.
Well, thanks.
There was also a question again about the name of the book that I mentioned. It is Natural Birth Control
I'm gonna look at that.
and How to Choose the Sex of Your Child. It's a report on the work of Eugene Jones, MD, by Sheila Ostrander and Lynn Schroeder.
No.
It's old with that. And you know, last year here is just really appreciation for a great presentation. You mentioned that one of the most common fertility challenges is miscarriage. The question is, can lifestyle choices cause miscarriage? And if so, do you have any nutritional recommendations?
Oh gosh. Well, I would still go right back to the autoimmune component, that habitual miscarriages. So basically, habitual miscarriages is any woman who's had multiple miscarriages without a live birth. So I consider multiple too. If I see any woman that comes to me and she's like, yeah, I've had 3 miscarriages and, still no baby, or I had a baby 4 years ago and then I've gone on, I've had 3 miscarriages. I mean, I immediately consider that she has an autoimmune component. Her body is attacking the embryo, or there's inflammation, like something's going on there. So it still goes back to the same principles of like the reconnecting, the renewing, the reawakening. And it is like, then further testing, can we get thyroid antibodies looked at, maybe refer her out to one of these reproductive endocrinologists, immunologists. I follow the work of Dr. Jeffrey Braverman a lot. He passed away recently, sadly, but he's kind of a leader in the field. And then this guy, James Beers, who wrote the book, Is My Body Baby Friendly, really gets into that as well. So do lifestyle factors impact it? Sure. I mean, I have a girl with Hashimoto's, and she's had, I think, 3 miscarriages. And we've also been able to genetically test the tissue. The embryo is normal. So she's miscarrying normal babies. That is not normal. That is not normal. So immediate red flag, like, okay, her body is attacking this embryo. Why? She has Hashimoto's. She just discovered it through working with me. I mean, which just makes me so furious. But it really does. It's like, why the hell is this girl doing IVF and no one's even checked her antibodies? She doesn't need IVF. She just needs to regulate her immune system. But so anyway, she has to travel to China regularly. And whenever she's in China for work, which I also think is just the long airplane rides are not the best for the body in general, but especially that consistently, she cheats on the diet. She just kind of eats whatever is available in China. And I get it. It's not an easy place to get around food-wise. But she inherently miscarries almost after every Asia trip. And I said to her this after this last one, I have her working with a really good doctor, Dr. Jonathan Scher. He's out of Mount Sinai. He's also a reproductive immunologist and just like a father of fertility. He's such a great guy. He's just like such a love bug. But I said no more trips to China, and you can't cheat on the diet. Like, and she was in tonight, and she's newly pregnant again, because she gets pregnant just fine. And she's like, gosh, I'm craving yogurt so bad. And I was like, well, you're going to have coconut yogurt and you're not going to cheat. Like, we are not, because I hate
How much do you want this? How much do you want this?
That, and like also that sometimes I think we can all say like, oh, 1 or 2 exposure is not that big of a deal. I disagree. I think in some cases that can be the deal breaker. And I never want to make it feel bad. I never want to say
it with autoimmune,
Like, this is what your body is basically allergic to these foods. And if you have it, you can compromise this pregnancy. At some point, like in 5 years, she could probably have it and probably not compromise the pregnancy, but she needs to regulate the immune system so it's all the same things when it comes to miscarriages. If it's miscarriages of a genetically abnormal repeatedly, I still think the same thing. Braverman has an interesting opinion on it too, that it's like, the abnormality happens during the cellular, which we know during the cellular division, which is like the Western people, like the regular REs basically say, oh, all your eggs are bad. Whereas Braverman is saying, no, it's the inflammation in the body that's triggering abnormal cellular division. So you gotta get the inflammation under control and the egg won't be bad. And I subscribe to that. That's very Chinese medicine almost too. It's a very epigenetics. It's like, no, it's the environment in which it develops in. So, you still would go back to the same exact principles, in my opinion.
All right, beautiful. That brings us to a wrap on the questions. I just really want to, give great appreciation for the comprehensive review and presentation that you gave here. I'm really glad to be able to have you go, the full amount of time and not skimp let us all know the valuable
Same.
information.
And I also have to say thank you to you because I don't do things like this. I want to do more of it, but as often, and I really enjoy the teaching component to other practitioners. So thank you for getting me into my joy. This was fun. Appreciate that.
Beautiful. Thank you. I have a few closing comments for everybody. So if you just hang for a couple minutes, I want to remind you that we recorded this webinar and it'll be available on our website under archived webinars in just a few days. There's also a survey to fill out after the webinar ends. You'll get a pop of that. And it always helps me a lot to have your feedback and any comments about this presentation. So I do appreciate taking a couple minutes for that. Our next webinar is on February 4th when we host Dr. Timothy Schweiger. He's presenting on functional nutrition for cardiovascular health. Our next All About Alumni graduate interview, I'm super excited about this, is coming up Wednesday, February 5th at 12 noon Pacific time, where I have the pleasure of interviewing our doctoral program graduate, Dr. Sheila Dean, who's going to be presenting on her postgraduate activities, her accomplishments, and her challenges. We've had so many previous terrific grad interview presentations, so you can check those out in our in our archives of webinars as well. I think that's it. This concludes today's presentation. So I want to thank you again, Aimee.
You're welcome. Thank you so much.
And I want to thank everybody for taking the time and sharing this educational experience together. I want to wish you all the best of health. And I sure look forward to learning more together at Hawthorn University's webinar and All About Us alumni series. Until then, I'm going to continue tending to my health as well as compassion and happiness and kindness, because what we practice grows stronger. So join me in this too, and I'll meet you back here in a couple weeks. Thanks, everybody.
Thank you.